Nothing. Okay. Hi, my name is Gloria. I'm gonna be your nurse today. Could you please tell me your name and date of birth? Okay. Just gonna double check that. Okay. And I'm gonna provide some privacy. Okay. I'm here today to do an assessment, head to toe assessment. And first, I'm gonna start with some general survey questions just to gather some information from you. Um, First, are you in any pain right now? No pain. Okay. Um, do you know where you are right now? You're at the clinic. Yes. You know what day of the week we are?
Yeah, Thursday.
Thursday. Yes. Okay. So when you came in, we checked your height and weight, and your BMI came as a 23, so which is normal weight. Now at the same time, I'm gonna check for her facial expression, because that could tell me also some information about her, if she's having any pain or if I see she's in some discomfort. Also the position and posture of the body. Okay, now I'm gonna take your vital signs. I'm gonna start with your blood pressure. Okay, could I touch your? Okay. Okay. And I'm gonna need my stethoscope. Okay. So your blood pressure is 118/77. Okay. Now I'm gonna check your pulse rate. If I could please. Okay. Okay. Um, your pulse rate was 80. Now I'm gonna take your temperature. Okay. And your temperature is 97.7. Okay. Now, while I was taking your pulse, I was also counted your respiration, which came up at 18. Now I'm just gonna do an assessment of the skin. Can I touch you? Okay, in the skin, I'm gonna check for the color of the skin. I'm gonna also touch both arms to check the temperature. Okay, I don't see any pallor, any cyanosis, or any jaundice. I'm also checking the skin of the face, in the scalp, hair distribution in the scalp. Okay, I see everything is normal. I'm gonna also check for moles on the skin. I don't see she has any moles, and also on the face. I don't see she has any on the face and the neck too. Now I'm gonna check for edema. Okay, I'm just gonna press. Yeah, I don't see any edema. Okay, Now I'm gonna proceed with the head and neck. Okay, I'm gonna start by inspecting. Okay, same. I'm gonna see if I see any abnormalities. I see her head is symmetrical and the face is symmetrical. I'm gonna palpate. Can I touch it? Okay, I'm gonna palpate to see if I see any abnormalities. Okay, any masses? No. Do you feel any pain? No. Okay. I'm gonna touch for the lymphoid nodes. Okay, so now I'm gonna do the. Okay, now I'm gonna palpate for the trachea alignment. Okay. Okay, now I'm gonna check the thyroid gland. Can you swallow for me? Okay, I don't see any overgrowth. Now I'm gonna check for. Now I'm gonna check the eyes. So first I'm gonna check that they're symmetrical. I see the eyebrows and eyelashes are present. I see the eyelids are no there are no drowning or sagging. Okay, now I'm gonna check the eyes. I'm gonna check the pupil and the iris. Okay, I see they're symmetrical. Okay, in the same size. Now I'm gonna light in her eyes to check for reaction. Okay, and then the other eye. Okay. Now I'm also checking for the okay, I'm just gonna check inside. I see it's pink and moist. Okay. Now I'm gonna check for the 6 cardinal fields. I'm gonna ask you to cover one eye with one hand. Okay, do you can you tell me how many fingers I have? 2. Okay. Okay. Now I'm gonna check the ears, the nose, and the throat. I'm gonna start with the ears. I'm just checking they're symmetrical with the eyes, and then I'm just gonna palpate for to see if there's any tenderness. I'm gonna light to see if there's any redness inside. No, any drainage, nothing. Okay, now I'm gonna check the nose. Same. I'm just gonna light to see if there's any inflammation, no redness. Okay, it is moist. Okay, I see the nostrils, they are symmetrical, and the septum, it is intact. Okay, I'm gonna check the sinuses, the maxillary sinuses, and the frontal sinuses, and no tenderness, no inflammation. Do you feel any pain? No? Okay, I'm gonna check the lips. I see they are pink and moist. Can you open your mouth for me, please? Okay, I'm checking the teeth. I don't see any missing teeth. The tongue, I see it's pink and moist, no white patches. I see the gums. The gums are not. I don't see any inflammation, no bleeding. They're pink and moist. I'm also. Can you please open your mouth and say ah? Ah. Okay, I'm checking for the uvula. It's in the same. Okay. Now I'm gonna proceed with the respiratory examination. I'm gonna first check for the client posture to see if she's having any trouble breathing. I have one question. Do you have used tobacco before? No. Okay. Have you had any lung disease? Okay. I'm gonna check for the symmetry of the chest. Okay. Now I'm gonna palpate the posterior of the chest. Okay. Do you feel any pain?
No.
No? Okay. Now I'm gonna do the I'm gonna also palpate the anterior of the chest.
Okay. So able to
I'm sorry, I'm gonna palpate the posterior of the chest.
now
Any pain?
no. I'm going to do the
Okay.
lung expansion. So
Okay. Okay, now I'm gonna auscultate. Can you breathe for me, please?
When she does the lung expansion, my thumbs move inwards and then
Okay.
outwards. Let me ask a question. Do you smoke?
Okay.
Okay. So she doesn't smoke at all. So now I'm going to
Okay. Now the posterior.
assess the if you have any kidney pain. So
Breathe for me.
does that hurt? Does that hurt? Okay, so she has no kidney pain at all. Do you have any chest pain? Do you
Okay.
have any?
Now can you please put one of your arms up?
Okay. So now
Okay. Can you breathe
I'm
for me?
going to listen to your heart sound.
Okay. Now the other side. Okay. Now I'm gonna proceed to do the cardiovascular examination. Now I'm gonna check for the. Have you experienced any chest pain?
No.
No. Okay. Any shortness of breath? No. Okay. Fatigue? No. Okay. Have you had any cardiac disease? Okay. I'm gonna inspect and palpate the skin of the chest. Okay, I'm just gonna check for the skin and I see the same, no pallor, no cyanosis. Okay, and then the posterior. Okay, I see. Okay, now I'm gonna auscultate the 5 cardiac landmarks.
So now I'm going to auscultate.
There's the aortic, then the pulmonary. Okay, mitral, and then the apical. Okay. Now I'm gonna proceed with the abdominal examination. So I'm gonna ask you if you could please lie down. Okay, first I'm just gonna see for the symmetry of the abdomen. I see the expansion. Okay, have you had any abdominal pain? No? Okay, so now I'm gonna ask you to take the bubble sounds. Okay, we're supposed to listen for 5 minutes, but for time purposes I'm just gonna listen just until I hear some bowel movement, some bowel sounds. I'm gonna start with the lower. Okay. Okay, now I'm gonna auscultate also the aortic, the aorta, I mean. Okay, with the bell of the stethoscope. Okay, the renal.
Okay, now I'm
Okay,
going
and
to
the renal.
palpate your abdomen. So first I'm going to start with the palpation.
Okay. Now I'm gonna palpate.
So let me know if it hurts.
I'm gonna percuss the abdomen.
Okay, so having no pain when doing head palpation or feet palpation. So now,
Now I'm gonna palpate. If you have any pain, just let me know, okay?
so now, I'm gonna assess your gait. So can you walk, over there and then come back? Is that right? Yes.
Okay, now I'm gonna do the deep palpation.
Okay, so, her gait is smooth and well coordinated. She doesn't go side to side. So now,
No pain?
doing the Rocker, test.
Okay.
So can you, demonstrate the
Okay.
close of your eyes?
Now I'm gonna do the musculoskeletal assessment. So I'm gonna help you. Stand up. Thank you. Okay. First, for the musculoskeletal examination, I'm gonna inspect her posture, and I'm gonna ask you to please stand up. Okay. Can you walk to the wall and then back to me? Okay, I'm assessing for balance and gait. Now I'm gonna proceed to do the lumbar test. Could you please just put your eye to the side and close your eyes?
Okay, so she is
Okay.
able to use her fingers.
I see. Now I'm gonna.
Hands.
Now I'm gonna do the prenatal drift test to check for the upper extremities. Could you please put your hands in front of you?
With resistance, can you lift your knee?
Okay, straighten up, and then just hold there for 30 seconds.
Lift her knees and then knee applying resistance. Okay, now can you do the shin to heel?
Okay.
Okay. She's able to.
Okay, you can relax now. Now I'm gonna ask you with your feet, can you do the heel to chin? Okay, and with the other one too? Okay, thank you. Now, did you feel any pain during those moments? No. No? Okay. So now I'm gonna do the neurological examination. Okay, first I'm gonna check for the tendons. And then I'm gonna
Okay, so it does two regular rhythm. Now the dorsalis pedis is also the regular rhythm, which is plus 2. Now it'll be the tendon reflexes.
Okay. Now the other one.
So just like the arm.
Okay. And now I'm gonna do it with your feet too. Do you think you can? Okay.
Now your leg.
Okay.
Okay.
Now the other one.
Okay, so
I'm gonna do it on the
that
feet
was the
too.
tendon reflexes. She's able to
Okay, and the other one.
move her leg.
Okay, now that I'm checking also her feet, I'm gonna check for any edema on the feet.
Do you have any questions?
Okay. Okay. Now at the end, I'm gonna do the cranial nerve assessment. So I'm gonna.
Have you in a comfortable position? I will place your call belt within reach and other items as well.
Okay.
Open the curtain.
I'm gonna do the cranial nerve assessment now. And so I'm gonna start with the olfactory one, and I'm gonna ask you to please close your eyes. Okay? And I'm gonna, can you smell that? Onions, yes. Now I'm gonna do the can you make any expression? Okay, that was the trigeminal nerve, and now I'm gonna, can you close your eyes? And I'm gonna touch your face and you let me know if you can feel it, okay? Okay. Can you feel it? Okay. That's your facial nerve. Now I'm gonna check for the trochlear. So I'm gonna ask you to open your eyes and then follow my pen, okay? Okay, that was your trochlear and abducen nerve. And now I'm gonna ask you if you could please swallow. Okay, that was your glossopharyngeal and hypoglossal. And then I'm gonna check for, can you make resistance? Can you try? Okay, that was your accessory nerve. Now we're gonna do the optic nerve. Okay, so we have performed the Peralta test, and her vision was 18/20, meaning that she can see at 18 feet what a normal people can see at 20 feet. Okay, this is a wrap up for the nutritional assessment. I'm gonna ask you if you could please tell me what you ate last night. Chicken soup. Okay, and when was your last bowel movement? This morning. Okay, did you see any abnormality? No. Okay. So that was all for me today. Do you have any question for me? Okay, I'm just gonna check for the safety. I don't see any cable on the floor. Okay, are you okay in that position? Would you like me to do something else? I'm okay. Okay. So I'm gonna document everything that I have right now, and thank you. Did I show you?